Yeah. Hope audio, video, everything is okay. How was the paper? Easy or tough? Yes. Fine. I got the message. Everything is fine. Just a minute. Just a minute. My link is great. Aman Khan says, oh, paper 1 is little difficult. We'll see. First question I start. Patient sample positive for infectious hepatitis B. Choose the correct marker for this condition. Always remember, we may have a question on hepatitis. I used to tell hepatitis serological marker, one question will be there. Mechanism of action, toxin, one question will be there. Selective medium, one question will be there. Vectors, one question will be there. Like that, we have some 8 to 9 topics. 100% there may be a question. So here, infectious hepatitis B, that means the person can transmit the disease from one person to another person. That's called infectivity. Infectivity due to two people. One is called hepatitis B envelope antigen. Another one is called surface antigen. These two people are responsible for infectivity. It's a direct question. Infectivity. Envelope antigen, high infectivity. But surface antigen also involved in infectivity. Got it? Envelope antigen, high infectivity. Surface antigen and envelope antigen both involved in infectivity. Next is patient positive for surface antigen and anti-HBC IgM. Surface antigen, anti-HBC IgM. It's a direct question. Many things came from DFX. I'll show the evidence. Okay. It is nothing but acute hepatitis IgM. It's nothing but acute hepatitis B. IgM. See here. This is the evidence of hepatitis B surface markers, acute hepatitis, surface antigen, anti-HBC IgM. It came. So if you know the markers, you have some questions. Sure. No doubt on it. This is our DFX question. I mean, slide number 75, you can see. Got it? So I used to tell, there won't be any direct question, but sometimes they may ask past infection, sometimes they may ask window period, depending, but we may get a question on surface markers. Next is chronic for IgG. Yes, Dr. Depki. Mechanism of action of botulinum toxin. Each toxin we should know the mechanism of action. Botulinum toxin inhibit the release of acetylcholine. Direct question. GABA glycine by tetanus toxin. Elongation factor 2 diphtheria toxin and pseudomonas toxin. Cyclic AMP, many people, example anthrax, cholera, many people. This question also came from DFX. Can you remember? I made one slide on exclusion toxins, exotoxin mechanism of action. See here, botulinum toxin, 123 slide, inhibits acetylcholine release. I got a feedback. One kid said, sir, I didn't read microbiology last minute. I don't know what to do. I studied only DFX. I answered many questions. Thank you very much. I make clear. Okay, inhibits acetylcholine release. Next is a person with history of long-term sexual relationship presented with painful ulcer, genitals with tender lymphadenopathy. What is the diagnosis? Painful, I used to tell in the class, cry. Pain means cry. So hemophilus do cry. And tender lymphadenopathy, suggestive of chancroid. Only tender lymphadenopathy, you can think of LGV. Chlamydia gonorrhea produces urethritis. Gonococcal urethritis, non-gonococcal urethritis, discharge. Painful means, remember, herpes, hemophilus ducrei, these people are painful. Excellent. Yes, Dr. Deepak, Bacillus cereus also increase the thing in acute vomiting in second phase, diarrheal phase. Yes, you are right. Chancroid is painful. Next is 70-year-old man admitted with murmur and blood culture positive for gram-positive cocci. Choose the common agent causing prosthetic valve infective endocarditis. Prosthetic valve infective endocarditis, think of first cons, coagulase negative staphylococcus, epidermidis. Second is viridans. Yearly 1 to less than 1 year, staph epidermidis. More than 1 year, viridans, but common is epidermidis. This also available from our FMGE Express, Great Express. You see here, I made, whenever you think of prosthetic valve, think of infective endocarditis, think of staph epidermidis first, second step viridans. Step viridans. Staph epidermidis, step viridans. Very good. Aditya Badmanaban, Dr. Idiopathic. Great. Next is group of friends consumed fried rice, Chinese fried rice in a restaurant. 6 hours they develop vomiting. What is the etiological agent? So fried rice is the very good clue for Bacillus cereus. But 6 hours vomiting, you can think of two people, Cereus and aureus. Cereus aureus causes vomiting. So you can go for Bacillus cereus. The toxin act like staph aureus toxin. This also available. See, I made food item with diarrhea. Chinese fried rice associated with Bacillus cereus. Over. Now you know the value of DFX. Short half-day session. But we may get how many questions? Evidence, you see. If you have the workbook, you just see 146th slide number. Definitely it will be there. Okay, right. Zank smear prepared from vesicle shown multinucleated giant cells. What are the diagnoses? Zank smear multinucleated giant cells. Go for herpes simplex virus. Now we call it as human herpes virus 1, human herpes virus 2. Human herpes virus 1, human herpes virus 2. Herpes. Zank smear for herpes. Direct demonstration from vesicular fluid. Multinucleated giant cells. Okay, multifaceted nuclei and multinucleated giant cells. Very good. Very good. Dr. Idiopathic. Yes, if drug abuse, IV drug abuse, it's staph aureus. Yes, my dear. Infected endocarditis. Former, presence with fever, conjunctival suffusion or conjunctival hemorrhage. Microscopic agglutination turned to be positive. Microscopic agglutination test, we call it as MAT. MAT test is a gold standard for leptospira. Brucella, we call it as SAT-B. SAT-B, standard agglutination test for brucellosis. So, human herpes virus 3, yes. Lepto, very good. Lepto. Questions are easy questions, high scoring questions. Panicity is important. Without panic, if you attend, it will be easy. See here, a newborn present with bilateral sensory neuronal hearing loss, salt and pepper retinopathy. Direct question. It is congenital rubella syndrome. I used to teach like this, CCC. Cardiac defect. Mainly we have patent ductus arteriosus, cochlear defect. We have bilateral sensory neuronal hearing loss, and congenital cataract. Salt and pepper retinopathy you can see in two people, syphilis as well as rubella. You can get salt and pepper retinopathy. Salt and pepper fundus also give hint. Yes, you are right, Dr. Deepki. Rubella. That's a clue. The two clue, one is bilateral sensory neural deafness and this one. A patient diagnosed with cryptococcal meningitis. What is the treatment? Direct question. Invasive cryptococcal meningitis. Treatment is amphotericin B with flucytosine. In case of non-invasive, fluconazole. Non-invasive, fluconazole is the treatment. But in case of invasive, you can go for flucytosine and liposomal amphotericin B. All from the notes. Without cryptococcal, nobody can teach microbiology. Any cryptococcal, definitely the treatment will be there. Okay, right. Next is a PLHIV admitted with headache, altered sensorium. CS of India Inc. Same. This time they ask questions from cryptococcus. 2 questions. Revealed the pathogen. Choose the correct organism. India Inc. positive. Go for cryptococcus neoformans. All other people non-capsulated, no use of India Inc. HIV positive, PLHIV, most common cause of meningitis, fungal meningitis is cryptococcus neoformans. Treatment flucytosine and amphotericin B, liposomal amphotericin B. Next is a firefighter admitted with cough. Culture shows, the image reveals gram negative oxidase positive bacilli. Firefighter, gram negative oxidase positive, and you see the colony color green. Transillumination, iridescent colonies while UV light, suggestive of Pseudomonas. It produces many pigments, pyoveridine, pyorubin, pyomelanin, like that. Pyoveridine, if you see under ultraviolet light, you can get iridescent colonies. PYQ direct question. Yes, my dear, you are right. PYQ, DFX, sufficient. Deadly combo. Okay, right. But if without reading the regular notes, you cannot remember, you cannot understand these things. We are giving high yielding, but before that you need at least 1 time or 2 times you need to read the regular notes. After that come with revision. The revision will be easy. Person came with history of thorn prick. That's all. Wherever thorn prick, rose gardener's disease. Ulcers along the lymphatic drainage. Choose the correct organism. Is Sporothrix rose gardener's disease. Ulcers along lymphatic drainage. Asteroid bodies. See here. I see my clue. Develop nodular lesions after pruning rose bushes. Rose gardener's disease. Sporothrix Asteroid bodies. Key points, 4 to 5 points. We may get a question on Sporothrix. Either anyone will come. This is also DFX. 150 slides, DFX. 80% question from DFX. See the evidence I'm showing. A patient with a cough diagnosed as tuberculosis. Choose the correct selective medium. I used to tell always we make it a selective medium question, because without culture, without bacteria, no microbiology. Without culture, there is no bacteriology. So we should know the culture medium. Yes, you are right, Dipki. Dr. Debaki. Great. See, what is the selective medium for tuberculosis is TCBS agar. Sorry, that's for Vibrio. Potassium tellurate for Corynebacterium diphtheriae. Thiamartin for Neisseria. LJ medium, Lonston Jensen medium. This also I have shown because tuberculosis is an important topic. See the slide 48 number DFX. LJ medium, rough buff tough colonies, Mycobacterium tuberculosis, virulent factor, something related. Yes, you're right. See how many questions now itself from DFX. A PLHV comes with multiple dog bites with punctured wound. Choose the correct. Multiple bites, bleeding comes under category 3. Category 3 needs rabies immunoglobulin and vaccine. With wound cleaning is default. Wound toileting is default. So you need to give local treatment, rabies immunoglobulin with vaccine. Next is patient admitted with knuckle rigidity. CSF analysis shows decreased glucose, where glucose decreased, protein increased. It is due to bacterial meningitis. Okay. Fungus also you may have, but fungus has lymphocytes. So it is bacterial meningitis. Any bacterial meningitis. Remember in my class I used to tell some common things. Okay. Any bacterial meningitis, the treatment is ceftriaxone, current treatment. Any atypical pneumonia, A for A, treatment azithromycin. Like that I give some clues to you. These clues are very important. Next is toughness of bacterial cell wall due to. Who is the backbone of bacteria? Cell wall. Who is the backbone of cell wall? Peptidoglycan. Gram positive thick peptidoglycan, gram negative thin peptidoglycan. That is due to the toughness. It is made up of N-acetyl glucosamine, N-acetyl muramic acid. N-acetyl glucosamine, N-acetyl muramic acid. Yes, my dear, ceftriaxone is the treatment. Lipopolysaccharide present, outer membrane present in only gram negative. Teichoic acid present in gram positive. So peptidoglycan, NAG and NAM. CATG mutation associated with. This I have taught in HIV TB. The two are very important. You need to know A to Z. So 9 faculties, 9 specialties, experts. We discussed about HIV and TB together. When I was discussing that, I put the slide. What is the mutation? How to identify drug resistance? CATG, AMC, INH, everything isoniazid. Rifampicin, you can go for RPOB gene. Levofloxacin, gyrase A. Like that. See the slide? Ethambutol EMB. Genes responsible for resistance. Isoniazid, rifampicin, pyrazinamide, ethambutol, fluoroquinolones, streptomycin, everything available. RPOB, remember. Okay. Others also. I put these two are important. Put in red color. When I am teaching itself, why I put red color? These two are important. If two people are resistant, then we call it as multi-drug resistant tuberculosis. MDR-TB. MDR-TB. Got it? Diagnosis of rickets cell antibody. To diagnose rickets cell antibody, we are using protease antigens. Name of the test is called Wilflix reaction. So, same type of antigen present in two different genus or species called heterophil antigens, and the antibody called heterophil antibody. Classical example, Wilflix reaction, VD oral test, Paul-Bunel test, same principle, monospot test. These are all examples for heterophil antigen antibody test. Wilflix test. We are using protease antigens to find rickettsial antibodies. Yes. We got many questions almost. Still some questions, if you can remember, if you inbox me, I can add. Then it become go to PYQ session. You may get the seat. Your juniors may be benefited. Okay, whatever questions available, just inbox me, I can add. Or any modification if you want to do with the choice or question. Total meaning of the question got changed. Don't worry about other choices. Some choices may be cooked up. Some from students. Frankly speaks. Suppose sometimes if you see the question whole meaning is totally changed. It is not the question. Then you can contact us. You can send the message, right question. We will add because you are sourced from us. Before exam, you used to listen us. After exam, we used to listen you. Okay? Got it? Go back. Hope you all enjoyed and made a very good attempt. Best performance in the exam. Soon I will see you in interview.